I'm Dr. Pat Mallory. Welcome to the practice. I'd like to take a few minutes to talk to you about regenerative injection techniques, what we call RIT. These are 3 different injection techniques that we use to treat ligaments and joints in patients who have chronic pain from ligament or tendon injuries or joint injuries that could even just be plain old arthritis. Regenerative medicine is a type of medicine that seeks to promote natural healing within the body. In other words, techniques that try to get the body to heal something that it has not been able to heal on its own. In the case of a joint that's painful because of arthritis or possibly because of damage to a ligament or a tendon that might attach in and around that joint, there are 3 different types of injection techniques that we offer that are all part of regenerative medicine. Those include prolotherapy, PRP injections, and PRP stands for platelet-rich plasma, and then stem cell injections. And in that order, they kind of go from less intense to more intense therapy. Prolotherapy is a type of injection treatment that has been around for literally hundreds of years. It uses inflammation as a natural healing process in the body. Our understanding of inflammation is that it's the natural response to injury. It makes sense if you think that when you sprain your ankle or have any other kind of injury, your body responds with inflammation. Unfortunately, we've become accustomed to treating that with anti-inflammatories. And that's our common mindset. However, inflammation is the natural healing mechanism. So with prolotherapy, what we do is we use solutions that we inject in the injured body part to promote inflammation so that we can get that body part to heal. PRP injections, again, involve injecting platelet-rich plasma. That is something that we prepare from the patient's own blood. So we draw blood from the patient's arm, spin it, and prepare this platelet-rich plasma, which, as the name implies, is a very concentrated amount of platelets suspended in plasma, and we've gotten rid of the red blood cells and the white blood cells. The reason that we inject PRP is that platelets are intimately involved in the healing process throughout the body. And so besides helping to form blood clots, which many people know they do, they also release growth factors, which are biologic signaling molecules that help to direct healing processes. So when a body part is injured and we inject PRP in that area, it greatly promotes some of the natural healing that the body can achieve in that area. Stem cell injections involve injecting stem cells to promote healing in a damaged area of the body. Stem cells are cells that exist in the body specifically to heal damaged tissue. They are capable of growing into new tissue. And so the stem cells that we inject when we do these stem cells injections have been collected from fat. So in other words, if I need to do a stem cell injection on a patient, I would have them in and we would extract some fat from their body, typically from the stomach, although we can take fat from anywhere else. The amount of fat that we need for a stem cell injection is 60 milliliters, which is actually only 4 tablespoons of fat. It doesn't take very much. From that amount of fat, we can actually extract 50 million stem cells, which is pretty amazing. The stem cells then are combined with PRP, again that's platelet-rich plasma, and that combination then is injected into the joint or the ligament or tendon or whatever it is that we're treating. And so when we inject this combination of stem cells and PRP, the stem cells seek out the damaged tissue and start to grow into new tissue in the area that's been damaged. And the PRP releases growth factors that basically stimulates the stem cells to do what they need to do. That's very individual, and there's no perfect answer to that. It kind of depends on what we're treating and the patient's own feelings about what they're willing to go through, and also what they can afford. One benefit of starting out with prolotherapy is you have the other treatments in reserve in case prolotherapy doesn't work. On the flip side, one benefit of starting out with stem cell therapy is then you've done sort of the platinum level treatment, and if that hasn't worked, then it may be that you need to see a specialist or a surgeon for whatever your particular issue is. So there's no perfect answer to that. The success rate increases as you go from prolotherapy to PRP to stem cell. The success rate with stem cell approaches probably 80+%, which is really fantastic. Most surgeons can't even offer that kind of benefit. PRP is probably more on the order of about 60 to 80%, and prolotherapy depends a lot on an accurate diagnosis. Sometimes some providers out there provide prolotherapy in situations where there's really not an appropriate injury for prolotherapy. But given an appropriate diagnosis and an appropriate injury that should respond to prolotherapy, probably again about 50 to 70 or 50 to 80% success rate. Unfortunately, at this point, none of these injection techniques are covered by insurance. So they do get a little bit more expensive as you move up from prolotherapy to PRP and ultimately to stem cell injections. We do have a variety of different ways to assist patients with payment options, and so if these are treatments that you're interested in, I would encourage you not to let finances be an obstacle to having a treatment that could help you. By all means, come on in and we can have someone talk to you about the different ways that you might be able to afford this. It's a very safe technique. All three of these different injections are extremely safe. Areas where we would not want to do injections would be areas where there's an infectious process going on, area where there might be cancer, injecting in a joint that has artificial parts in it, certainly a joint that's already been replaced. We're unlikely to get any benefit from these injections, and they would also increase risk for infection in that sort of a setting. Patients who have to take anti-inflammatory medicines or steroids on an ongoing basis, that affects the likelihood that prolotherapy would work, because again, those medicines will counter the inflammation of prolotherapy. So anyone that requires ongoing anti-inflammatory or steroid medication for whatever health issues they might have, they would not be good candidates for prolotherapy, but they might still be very good candidates for PRP or stem cell. Otherwise, it can be done in a wide range of different conditions. They're very long-lasting. Because these injection techniques are literally promoting natural healing within the body, when they work, essentially the body has healed itself. So unless you re-injure those structures, we don't expect that you're going to need ongoing treatment. There shouldn't be any requirement for chronic, repetitive prolotherapy or PRP, and certainly not stem cell injections. In fact, stem cell injections really should only require one treatment, period. No, it's not only used for chronic injuries. However, for a fresh injury, what we call an acute injury, in general, I try and get patients to see if their body might be able to heal on their own. Now, in certain circumstances, patients might not be willing to wait the 2 to 3 months for something to heal, especially if someone's a professional athlete, or they are going to lose money, or it will impact their job otherwise if they were to have to wait for natural healing to happen. So you can certainly do any of these injections at any point after you've had an injury, but the most common is to wait until after natural healing would have already happened. It doesn't appear to be able to completely fix the area. And that's typically about 6 weeks to 2 months. So after about 2 months, if an injury has not healed back to a comfortable baseline, that's the most common indication to proceed with these injections. Physical therapy plays a very important role. Depending on the degree of pain and the impact on overall function, sometimes we will not have someone in physical therapy for the first couple of treatments, in the case of prolotherapy and PRP. And that's because we want to achieve a certain amount of healing before that body part starts being taxed by exercises. But at a certain point in the healing process, it becomes important for the patient to have some rehabilitation under the direction of a physical therapist in order to restore normal motion and normal interaction of the different muscles in the area, and that in turn further promotes healing of the body part. The answer to that in part depends on how far from your normal routine you are before we do the injections. Some people haven't worked for quite some time before we treat them, and so we don't expect them to get back to work right away. But yeah, if you've been working and functioning in a fairly normal capacity, we don't really expect any downtime whatsoever from these injections. Again, with the stem cell injections, primarily because of the fat harvesting, we usually do recommend that you consider being off work for 2 to 3 days. For that purpose, we usually tend to schedule those on a Thursday, which ends up being good timing because people can hopefully take Friday off and be off for the weekend, and by Monday we expect they'll be back to work. Thank you very much for taking the time to listen to our discussion on regenerative injection techniques. I hope that this was informative. If you happen to be someone or know someone who might benefit from these injection techniques, I would encourage you to consider coming in to talk to me or one of the physician assistants in the practice. We'd be very happy to see you and discuss these with you in more detail.